Thank you all for joining us today, and welcome to this webinar, Creating Healthy School Environments with Health Equity Works. My name is Jordan Buckley, Manager of School Health Programs with the Society for Public Health Education, or Sophe. On behalf of Sophe, we are excited with the interest in today's webinar and are thankful that you have taken the time out of your day to participate. Before I hand it over to our speaker today, I'd like to cover some housekeeping items. First, please know that all attendees are muted for the duration of today's webinar. To interact with the speakers, please use the chat box. After hearing from our presenters, we will have a question and answer session with the time remaining. Questions can be submitted at any time during the webinar by typing in the chat box. We value your feedback and ask you to complete the feedback form that will pop up in your internet browser immediately following today's webinar. Your evaluations of this program will assist us in planning future webinars. Please know that today's webinar is being recorded and will be made available on demand on Sophe's School Health playlist within 2 weeks. As a quick introduction, Sophe is a nonprofit organization founded in 1950, dedicated to providing global leadership to the profession of health education and health promotion and to promote the health of all people. Members include health education professionals and students throughout the United States and internationally. The organization promotes healthy behaviors, healthy communities, and healthy environments through its membership, its network of local chapters, and its numerous partnerships with other organizations. Now, I am excited to introduce today's speaker, Emily Kreiser. Emily is a project coordinator with Health Equity Works, a research-based initiative housed in the Brown School of Washington University in St. Louis that specializes in bringing quality, accessible research on health disparities into communities to accelerate collaborative action and systems change. Emily currently supports the research and translation arm of Together for Healthy and Successful Schools, an initiative of the Robert Wood Johnson Foundation. In this role, she works to disseminate the Healthy Schools Toolkit to schools and districts across the nation. She is passionate about lifting up the voices of educators, families, and community stakeholders through data-driven storytelling and other means of effective dissemination. Emily, I'll hand it over to you.
Thank you so much, Jordan, and thank you everyone for being here. I am excited to be able to share with you today some of the work of my team, and I'm grateful for Jordan and the Society for Public Health Education to invite us to share our work as part of their Healthy Schools webinar series. I'm going to get my slides going here. Today we're going to focus on answering a few questions, starting with the question of why do we consider health and education together? After that, we'll dive into what makes a school healthy, safe, and successful, and also how can we start to build those healthy schools? And finally, we'll end with, I hope, what will be a really great discussion and be able to answer some of your questions. So just as a reminder, you're welcome to post questions throughout the webinar, and we'll answer them towards the end. So in terms of objectives, by the end of the webinar, we're hoping that all the attendees will be able to first be able to examine the human and system factors that enhance or impede the process of implementing the whole school, whole community, whole child model. We also hope that you as learners are able to select and design strategies and processes detailed in the Healthy Schools Toolkit to assess the networks, messages, and the systems that you need to implement a healthy school approach. We are going to start with a few poll questions to get a sense of the framing that everyone brings to our discussion. So in a few moments, Jordan's going to help launch a series of questions, and we'll go one by one on these. The first question is, have you heard of the whole school, whole community, whole child model? I have the answer options here on the screen, and then I believe Jordan will launch the survey, and you'll be able to answer this here in a moment. Okay, and hopefully you all have had a chance to answer this question. If we have our responses. Okay, I'm going to move on to the second question. I'm not sure if that first one was registered, but we want to get a sense. The second question is, to what extent do you agree that you have the tools to create a healthy school? Okay, we're going to move to the next question. The next three questions are going to be similar. They're going to ask you to rate the importance of something related to creating a healthy school. So first, we ask you to consider how important people are in creating a healthy school. Next, consider how important systems are in creating a healthy school. Once you've answered that, the last question, how important are messages in creating a healthy school? All right. I'm not sure if the poll results are available to be shared with everyone, but if not, that's okay. We can also make sure that we revisit that at some later point. I'll go ahead and move on to, we really want to start this discussion by talking about why it is important to consider education and health together. One reason is that there is a close and bidirectional relationship between health and education. Not only are higher levels of education associated with good health, but children and families in good health tend to have better education-related outcomes. If you work in a school, you are most likely familiar with the ways that this bidirectional relationship play out. You see it every day. A simple illness, whether that's of a student or one of their family members, when compounded by a lack of access to health care, can quickly escalate to many days missed and a dip in their academic performance. And this single experience is often amplified across a student's life as one's educational attainment has a direct impact on a student's ability to be employed, which in turn provides greater access to safe neighborhoods, quality housing, medical care, and health insurance. In fact, research suggests that policies that address social factors like education could have a bigger influence on health than all medical advances combined. For many of you joining us today, the notion that health is a vital and necessary part of education is likely not a new idea. It is an important place to start, however, because it underlines the significance of our next question: what makes a school healthy? One approach to understanding what makes a school healthy is to consider an evidence-based framework or model. The image you see on the screen is called the Whole School, Whole Community, Whole Child, or WSCC model for short. And I'm going to pop over and see from the poll that we did, just want to see, thank you all for taking the time to answer that question. I want to see here, the majority of folks on the webinar today have heard of the WSCC model and know it well, but a few of you have heard of it, don't quite know it all that well yet. So I'm excited that we're able to dig into this model a little bit more. The WSCC model is a comprehensive framework designed to represent the ideal atmosphere for improving students' health and educational outcomes. The model was co-developed by ASCD and the Centers for Disease Control and Prevention in 2014. And since that time, substantial evidence demonstrates that the model is effective. From our perspective, the best way to understand the model is to really break it out into its elements. The first element is at its center, which names the 5 tenets of a whole child approach to education. In this approach, all students are healthy, safe, engaged, supported, and challenged. And by putting the whole child at the center of the model, we are reminded that this should be the center of everything that we do. The model also highlights 10 components that need to be addressed to achieve whole child health and to fully support the physical, social, emotional, academic, and cognitive aspects of students. These components range from things that are more traditional to the school health field, such as physical education and the nutritional environment of a school, to emerging priorities, such as employee wellness and the social and emotional climate of a school. Together, these 10 components create a holistic and comprehensive approach to a healthy school. Wrapping around all of this is the community. As you know, schools and educators can't address all of the 10 components by themselves. Community partnerships are critical to schools having the capacity to meet students' needs. We are also reminded that not all communities have the same resources or face the same challenges. Some schools and districts may have easier access to partners who can respond to students' needs, while others don't. All of this requires us to apply an equity lens to our work as we support schools to be healthy, safe, and successful. And finally, the last aspect of the model that I want to highlight is that of coordination. The center ring that reads coordinating policy, process, and practice, improving learning and improving health, can often be overlooked. But really, it's the ring that binds everything together, and is the center of many of the questions related to the WSCC model. What does it mean to coordinate policy, process, and practice? And how can a school do that? This is where we see the value of some of the work that our team's been doing over the past 2 to 3 years. And this is where we'll spend most of our time today. Focusing on the how really helps to unpack or operationalize what it means to do this alignment and coordination. And we believe that the how-to lies in understanding the people, systems, and messages necessary for implementing this model. As we like to say, frameworks don't implement themselves. Rather, people, embedded within functional systems and armed with the right messages, implement frameworks. And over the past 2 years, our team has had the opportunity to work with schools and districts to use a few different social science methods to understand people, systems, and messages, including social network analysis, group model building, and message testing. As Jordan mentioned, this work has been funded as part of the Together for Healthy and Successful Schools initiative, which is funded by the Robert Wood Johnson Foundation. As the research and translation arm of this work, we've partnered with a few different high-need school districts in the St. Louis area to conduct research in order to determine the key relationships and people, the messages, and the systems needed to implement the WSCC model. And using our findings, we worked with our partners to co-develop the Healthy Schools Toolkit, a tool designed to help educators build healthy school communities that support the whole child and lead to student success. And in this work, we're grateful to be joined by 2 co-grantees, America's Promise Alliance and Child Trends, who have focused on strategic action and alignment and policy, respectively. We released the toolkit to school and district leaders in the St. Louis region in the summer of 2019, and over the past few months, we've been working with a cohort of schools and districts across the nation to support them as they implement the toolkit. So we're going to do another quick poll to see whether before today's webinar, have you heard of the Healthy Schools Toolkit? I'll give you a moment to answer that question. And I will peek over to see what our results are. So thank you for taking the time to answer that. I hope today will give you a great introduction to the toolkit and to stimulate some thinking about how it can support your work to create a healthy school. I'm going to take a bit of time to kind of share a little bit more about the toolkit and also then follow up with an in-depth description about the strategies that you'll find in the toolkit that you can use. So our goal in developing the Healthy Schools Toolkit was to create a unique tool that gave explicit instruction to help school and district leaders understand and leverage their people, systems, and messages. As I'll share in a moment, the toolkit is divided into 3 separate modules focused on people, systems, and messages. This allows schools and districts to do the work at their own pace and to order the work according to their needs. So I'm going to provide a brief introduction to some of the features of the toolkit. One of the most important features is that it builds on and complements many of the existing resources related to the WSCC model. Throughout the toolkit, you'll see that we call out when this resource aligns with processes described in other resources, such as the National Association of Chronic Disease Directors WSCC Implementation Guide. The toolkit also emphasizes process. We felt that educators get a new what every year, and we wanted to make sure that this toolkit helps answer the question of how. The processes required to complete each module is detailed in step-by-step instructions, as outlined here in the image that you're seeing, which is a quick start guide that is the start of each module of the toolkit. Each module also features a series of templates and activities like the one shown here that break down each of the steps into small, actionable chunks. We also felt it was important to provide clear examples of the impact that this work can have on schools and districts. So each module starts with a hypothetical story, like the one shown here, and the modules conclude with an in-depth case study based on our experience doing this work in St. Louis. Finally, we felt it was important that the processes described in the toolkit be applicable to any school or district, regardless of their needs and resource levels. For this reason, we developed a spectrum of activities and options that can help schools and districts customize the work in a way that is feasible for them. The time, resources, and expertise needed for each of the options laid out in each module are outlined at the start of each module. The chart that you're seeing here also includes the outcomes that are possible from each option. So I'd like to now spend some time providing a brief overview to the strategies and processes detailed in each module, and I will start with social network analysis. Social network analysis allows schools and districts to understand the characteristics of their social network. It helps them understand how information is shared within their community, who the key players are in terms of sharing that information, and it offers suggestions for how to leverage those key champions as influencers on behalf of school health. The social network analysis process is broken down into 6 steps in the Healthy Schools Toolkit, and within each of these steps there are a variety of ways to customize the work to your informational needs and capacity. The 3 options by which you can customize your work allow you to do the work and achieve slightly different outcomes. So option A helps you to identify potential key influencers. Option B builds on that and allows you to measure the frequency of communication and the level of trust that key influencers have with one another. And option C takes it one step further and provides you a visual representation of the social network, thus providing you with as much possible information about who's a key influencer in your network and any barriers and facilitators they have in sharing information. The network map that is possible if you choose this last option is really dense with information. Each dot represents an individual in a social network, and each line represents connections between those individuals. These dots can be colored and sized according to the individual role and the number of connections that they have with others. And depending on what option you choose to pursue, you can begin to understand some additional ways to understand this network map. For example, the density of the map really speaks to how close everyone is in a school or district, and the map can help you piece that apart. Group model building is a process highlighted in the second module of the toolkit. It helps groups of people solve large, complex problems together. And in our research and work in St. Louis, we use group model building to help school and district stakeholders identify the factors that impact healthy, safe, and successful school systems and understand how those factors are connected to one another. You can also use group model building to help your folks in your community identify opportunities to intervene and to understand the intended and unintended consequences of the interventions that you choose. At its core, group model building allows groups to problem solve as a team. And that's accomplished through a variety of activities. But the grounding to all of those activities is the idea that you're bringing people together who have very different perspectives. And together, they're able to really have a better understanding of what's going on and what are some potential solutions to the problems that you're experiencing in a school or district. This process can really be described in similar terms as the famous parable of the blindfolded persons and the elephant. As the image that you're seeing here from the toolkit shows, if a blindfolded person encountered an elephant's tail, he or she would think it was a rope. But if they encountered a leg, they think it was a tree. We, like the blindfolded people, all are limited by our perspective, and it's only once everyone's at the table that a problem can really be understood, taken apart, and some solutions identified. So like the people module, the systems module is broken into a series of steps, and you can customize your work according to your needs and capacity. In this module, however, the complexity of the options builds in terms of the number of people and perspectives you include in the process. And as you involve more people, you're not only able to create a map of the systems, structures, and policies needed to implement the model, but you're also able to build common language and understanding of the factors that influence a healthy school, and to create new partnerships and connections to support that work. And as you continue to include more and more people and perspectives, you can be confident the model that you build is reflective of the experience of various perspectives and roles in your school community. One of the outputs of group model building is something called a causal loop diagram. You can see on your screen an example of a causal loop diagram from our research in St. Louis. What's illustrated are those factors, like parental involvement, which stakeholders felt impacted their school environment. The arrows connecting the factors specify the direction and polarity of the relationship between factors. For example, our stakeholders indicated for this particular district that parental involvement has a positive relationship with attendance. So as parental involvement increases, attendance also increases. As you might notice, these diagrams can become quite complex when you're talking about what makes a school healthy, safe, and successful. And so thankfully there are a variety of methods to make meaning of this complexity. One option that we found very helpful was to apply the WSCC model to the diagram to identify the ways in which individual components of the WSCC model contribute to a school system. In the version of the causal loop diagram that you're seeing now, we've overlaid the components of the WSCC model that stakeholders identified in their discussion. So different colors have been applied to factors that relate to different components. For those of you who are more familiar with the WSCC model, you might notice that not all WSCC components are identified. But this in itself can be a revelation in terms of understanding what really shows up when you ask people what contributes to a healthy school. It's also interesting to note which components are more intertwined. For example, employee wellness, which is color-coded in orange here, was identified by our stakeholders as being tightly connected with social and emotional climate, which is in that royal blue color. Another way to unpack these diagrams is to highlight the opportunities for intervention. The diagram that you're now seeing has some words in black and some dotted black arrows, and those are all interventions that our stakeholders identified as ones that they'd like to try out, that they think could impact the system. The final process that I'll briefly share about is highlighted in the third module. And this process is called message development and testing. So message testing is an iterative process that helps to identify messages and stories that resonate with key stakeholders. It is also helpful in identifying effective messengers and messaging strategies that reach different stakeholder audiences. The messages module is again broken down into a series of steps And like other modules, there are 3 options by which you can customize your work. Option A allows you to use messages that have worked in other schools and districts to create effective messaging campaigns in your own community. Option B introduces some tailoring activities to allow you to identify specific messengers and messages that resonate with audiences in your school or district. And option C allows for additional tailoring, but this time of the messaging strategy, so the ways in which that you reach your audience members. Thankfully, the output from message testing is quite a bit less complicated than the first 2 modules. The messages shown here on the screen are ones that tested well among the schools and districts with whom we worked. We found that messages that express empathy for students and families, that are relatable to the lived experience of educators, and that make a specific ask resonated with our stakeholders. It was also important that those messages be shared by well-connected and trusted leaders and peers. In these examples, you can see the themes of teamwork and empathy come through. As a result of working through this final module of the toolkit, you will be able to understand 3 key elements of an effective message: the messenger, or the who, the message, the what, and the messaging strategy, the how. For each of these elements, the toolkit provides some activities and tools that help schools and districts identify the specific who, what, and how that allows their messages to reach the right people and have the impact that they want. For example, for messengers, the toolkit provides an overview of the unique qualities that different messengers provide to a school or district. The toolkit also provides a message framing activity which guides schools and districts in developing and testing specific messages among different audiences. This message framing activity comes to us from the Spitfire Strategies tool. And finally, there's a lot to consider when you're trying to identify the right messaging strategy for your school or district. Do people respond to email, text, or phone? Do they prefer one-on-one messaging or larger group events? These factors and others are all addressed in the toolkit, along with some activities to help you think through what's best for your school or district. So in our last few minutes before we get to your questions, we just want to check in, and we have a final set of polling questions for you. So I will go through these questions, and again, I encourage and thank everyone who's able to provide feedback. The first question asks you to consider to what extent you agree that the Healthy Schools Toolkit can help you to create a school, to create a healthy school. So take a moment to share your answers. That would be wonderful. The second question is, what is your most likely next step to apply the Healthy Schools Toolkit in your work? For this question, you should be able to have the option of selecting multiple responses. And finally, we ask you to reassess how important people, systems, and messages are in creating a healthy school. So again, you'll have 3 questions to answer, starting with how important are people in creating a healthy school. How important are systems in creating a healthy school? And finally, how important are messages in creating a healthy school? Thank you again for all of your responses and for joining me today and hearing a little bit more about the Healthy Schools Toolkit. I look forward to answering your questions. I also just want to take a moment to thank the Robert Wood Johnson Foundation for supporting the development of the toolkit and this webinar. And I encourage you to visit healthyschoolstoolkit.wustel.edu to check out the toolkit, all of the videos and supplementary resources that are available, and also to connect with our team if you want to learn more.
So at this time, we'll give everyone a moment to run through those surveys so you have the chance to answer, and we'll send you the results that you can run through for each question, which are now all available. And Emily, you are now able to access the results of all of these recent questions. And to the audience, please think of any questions that you have throughout the presentation, whether it's a slide that you would like us to touch on, or if it's a question that you have about the work that was presented, or the WSCC model, or the work moving forward, and we can run through that. If you have not been familiar with the Healthy Schools Toolkit, you can type that as well, and we'll run through that. We went through the surveys very quickly for the sake of time, and so we can run through that as well. And I'll hand it back to Emily to run through some questions, and I will assist. So everyone just take a second and submit that in the Q&A box.
Thank you, Jordan. So here, I'm just going to go through the surveys very briefly. Thanks again for everyone who's able to see that. And then I do see a question from someone. We'll return to the contact information of the speaker once I go through the surveys. And please enter any other questions that you might have. So again, the majority of folks have heard of the WSCC model, which is great. Hopefully today solidified some of your understanding there. The majority of folks on today's webinar agreed or somewhat agreed that they have the tools to create a healthy school. Wonderful. That's great to hear. And it looks like everyone agreed that people are very important to creating a healthy school. Most of you thought systems were also very important to creating a healthy school. And maybe a few of you needed some convincing. They thought that messages were somewhat important to a healthy school. It's great to hear that most of you agree that the toolkit can help you create a healthy school. And I'm excited to see that a lot of you would like to read more about the toolkit, share the toolkit with some of your colleagues, and also get in touch with our team to learn more about the toolkit. That's wonderful. So thank you all very much. I'm going to go back to the slide that has our website, healthyschoolstoolkit.wustel, that's WUSTL.edu. That's the website where you can find the toolkit. There's also a contact us form where you can sign up to learn more and also make a direct request to be in touch with our team.
Emily, I'll share a new question that we have. How practical are causal loop exercises in school communities?
That's a great question. So I think there's two aspects to that question that I'd like to address in terms of how practical causal loop exercises are. I really think the magic of systems dynamics and causal loop diagrams is the process that you engage with your school stakeholders. So in our experience, they're very helpful if you have the time to be able to sit with a group of folks and plan out what your workshops are going to be, because the learning process really happens when you're in the room with other people. The diagrams themselves, you might want to think about them as artifacts or tools that you can use as you begin to think about what strategies you want to implement. So again, take the time to do the planning process and to really help facilitate a good process for your school or district. And don't worry too much about the nitty-gritty of the causal loop diagram being just perfect or just right, and focus more on the process. We also had a question about what is the best way to approach a school about using the toolkit. That's a great question. We had in our work in St. Louis, we had the benefit of having some deep and embedded relationships with a few districts. So we had an easier time making the case for why this would be a good tool for them. And again, they were a bit of our pilot, so they were on board to try it out with us. But my suggestion for anyone who'd be interested in approaching a school about using the toolkit would maybe be to consider if you have a school or district with whom you have a relationship, if you know that they are working on an issue related to school health. Maybe they're doing the school health index as part of their health or wellness committee, that's a process that they're doing. We really see that this toolkit is a process tool. So once you have an idea of maybe you have a group that's working on an issue related to health, this might be a tool that helps them process and understand some next steps about that particular issue or problem. I'd also suggest looking at considering the options charts at the front of each module. Again, we knew that it was really important to be able to allow the toolkit to be modular and actionable to schools and districts, even for those who might just have 30 minutes to work on the toolkit, in a month's time. So take a look at those option charts, and they lay out the time, the staff capacity, and the types of expertise that you or the school might need to be able to work on the toolkit. We have a question, is the toolkit part of the school health index? It is not part of the school health index. Again, we see, we were hoping that the toolkit could be a complementary tool to the school health index. So if the school health index is helping you to answer what do we need to work on, then the toolkit itself is more of a response to, well, how do we work on that problem? I know we have some more time, so don't hesitate to let us know. Type in some more questions if you have them. If you want to revisit anything in the presentation, I'm happy to do so. The question, were the schools you worked with provided any incentives to work through the people, systems, and messaging component? That's a great question. For some activities, yes, we definitely, gave I believe for each of the interviews and surveys that were conducted as part of the social network analysis and the message testing. We provided incentives to anyone who participated if they were allowed to receive incentives. So in one district, teachers were not able to receive incentives, and so we kind of created a workaround to be able to provide the schools with the funding that was allocated for that purpose, regardless of the individuals being able to receive the incentives. So yes, we did for most of the activities. For the group model building workshops, the practice that the folks who led us in that work and who are experts in the work, they find that they get better participation and more broad participation if incentives aren't provided, but those workshops are a little bit longer, so I would suggest considering providing a meal if that's possible, and childcare if that's possible, and also really, considering when you hold those workshops. It's a little bit more difficult to find a time that works for both educators, and if you're involving families and community partners in that work, that can be tricky. But again, if you set aside time to do the planning and to do it in advance of when you want to hold the workshop, we were generally able to find something that worked, usually over the lunch hour or in the early afternoon. And sometimes we were able to make use of professional development days in a district to make that a little bit easier on educators. We have a question here about whether we're planning to extend the work to other districts outside of the St. Louis region. And that is a great question. We are actually in the process of facilitating a community of learning with 12 schools and districts across the nation to get a better understanding of how the toolkit can be implemented in communities outside of St. Louis. And so we're in the middle of that process, and again, it's really a learning opportunity for us to get a better sense of what is the resources, whether that's technological or in terms of technical assistance, more one-on-one learning that can support schools and districts doing this work. So we'll be excited. We started that in January, and we'll be going through June. So we look forward to being able to make some of those resources and TA resources more broadly available once we've gone through our learning with that first cohort of districts. And if you are not part of that community of learning but are interested in using the toolkit or talking more about what we're learning as part of that community of learning, our team would be happy to talk with you and to get a sense of what your needs are and interests as well.
Unless there are any other questions, we can continue to share some other resources that we have for this webinar. For more school health content, visit the Sophe School Health resources, which are available on sophe.org, and visiting the Sophe School Health page, which is at the Sophe School Health focus areas. The resources that are listed on this slide are supported through the Sophe and CDC 1802 School Health Project, which include the WSCC team training modules, a social and emotional learning guide, which is the SEL in school health, addressing SEL through the whole school, whole community, whole child framework, a WSCC fact sheet series, Sophe Journal School Health special issue, and this School Health playlist, School Health webinar series, which this webinar is supported from. We would also like to thank again Emily for supporting us with this webinar today and talking more about the people, system, and messages that are part of promoting healthy environments and healthy schools and all of the work that goes into that. So thank you again, Emily, so much. And if you would like to reach out to learn more about the extra resources that are out there in the field and contacting Emily, please email Emily Kreiser at wustl.edu or reach out to us at education@sophe.org and we'll connect you to her right away. Emily, thank you again so much.